Welcome to OrthoPod, a podcast about the people of orthopedics and their stories. We understand that we all play many roles in our careers and lives, and it is these very stories that ultimately inform our successes and failures. I want to welcome you to OrthoPod, a podcast for the people of orthopedics and their stories. And today is going to be an interesting session. We've got Darryl Yardley. And Darryl is a friend and colleague. I've known him for 5-6 years now at least, right?
Yep.
Let me give you a little bit of a bio. He's a Senior Director of Quality, Risk Management and Clinical Services at BCHS, which is?
Brant Community Healthcare System.
Brant Community Healthcare Center. He is a part-time professor of Business and Entrepreneurship in Physical Therapy. This is a course at Western University. He also lectures at McMaster University, the University of Toronto, Queen's University, and he primarily lectures on business and practice management topics. He's a consultant with a number of orthopedic and neurosurgeons and has a special interest in hip and spine. He's also co-authored multiple papers, and he's presented at numerous conferences. He's been keynote at a number of conferences, and he's founder particularly of something I've been following quite a bit of, is this Mentorship Bootcamp, a program offering business training and career coaching to practicing clinicians. He's an advisor with Clinical Accelerator and consults with many clinic owners to grow their business. He's recruited and mentored well over, in this case, well over 100, but I suspect that number keeps growing.
Yeah.
And where can people follow you or interact with you if they want to, Darryl?
Yeah, I think the best way would be just through Instagram, and it's just at Darryl Yardley.
So you can follow Darryl if you're interested in the content at Darryl Yardley on Instagram, and you'll get back to folks as they do so. Okay. So when we think about all the things you're up to, specifically in the area of rehab and physiotherapy, what are the big concerns right now for practicing physiotherapists? I mean, we obviously talk about research, we talk about practice, we talk about administration, ownership. What are the big issues that you come across when you interact with physiotherapists? Yeah,
great question, Mo. So I think there's a big three in my mind. So the first one is going to be the fact we just did the Conference Board of Canada did it in alignment with the Canadian Physio Association and the Private Practice Division, and they did what is our unemployment rate right now? And as of 2017, the unemployment rate for physiotherapists in Canada is 0.3%.
Wow.
Yeah. So, when most people have that same reaction, and it's, well, what does that mean? Well, quite frankly, if you have a job and you're looking to fill a vacancy, no one's sitting on the couch waiting for that phone call. So it's created a very competitive market.
This is completely, and I'm not sure if you're aware what's happening in orthopedics in Canada. It's quite the opposite. So, last count, was somewhere between 100 to 150 orthopedic surgeons who were without a permanent position, who had been trained in Canada. So it's a very different situation, but go ahead.
Yeah. So what it does, though, is if you look at now system-wide, there's the demand for physiotherapy and our service delivery far exceeds the supply.
Yeah.
So now you actually have two things battling. So you've got a profession itself that says, we're a key player to healthcare solution problem, or as a healthcare solution to all these massive problems with aging demographic, increased complexity of disease, but we don't have any individuals to help solve those problems. So what we've seen, though, is we've seen two things. We've had a challenge in our profession where what do we do with the assistant model? Yeah. How do I go from being a technician and very tactical as a physiotherapist to all of a sudden I'm working in a delegated model where I'm working with an assistant and they've become my technician, right? So looking at it from a World Health Organization perspective, which is where they've called it as task shifting. So very well known in the dental model, very well known in the medical model. But despite it being around for quite some time, still very new and not fully accepted yet in the physiotherapy world, especially in private practice.
Wow.
Public sector, you've kind of been forced, right? I shouldn't say forced. Because of resource allocation challenges and again, demand and looking at budgetary challenges and fiscal constraints in a hospital, you haven't really had a choice, right?
Yeah.
You're always looking at new models of care to deliver services. But in the private sector, I have a choice still. Do I give one-on-one physiotherapy care with PT and patient, or do I work in a model of care where I work with an assistant and I actually impact more patients in a given day? But this is where our third big challenge comes into play, which is where we have a younger generation of therapists who come into an organization or to a clinic and their expectations are a lot higher than my expectations when I graduated 13 years ago.
Right.
I graduated.
I think that's a universal. This generation, just because of where we are, believe that what we called you've got to do it this way doesn't always apply anymore.
Yeah, absolutely.
Right.
And I think that there's a piece though is around, we all paid our dues and this is the way it has to be.
Right,
I graduated and I think I made $68,000 my first year of practice. And now, there's individuals making over $100K in their first year of practice. And it creates a lot of turmoil and angst amongst clinic owners specifically because it's like, well, I can't afford that.
Yeah.
Or there's you don't have any experience and you haven't even proved yourself yet. So why are you worth that much money? But if you look at our industry, and if we have a 0.3% unemployment rate, you have rehabs become Starbucks. There is a rehab facility on every corner,
right,
and sometimes across the street from each other.
So then, how do they differentiate? Which is I think you're getting to it, right? So I guess the point is, what advice do you give to physiotherapists? But similarly, what advice do you give to the owners of the clinics, right? That's the two things.
Exactly, and that's a great point because this is the thing. So I'll have owners will come and rightfully so, and I want them to challenge what I'm saying is that that someone's going to demand higher salary than what you and I believe is fair. However, we're in a scenario though right now where unfortunately we're not in the driver's seat. The clinician's in the driver's seat if you want to fill that vacancy,
right,
and you want to impact the amount of patients in your community that need your services.
Right. So
what we started to get people to focus on though is your offer has to be better than the next offer. And right now you could probably Google in Ontario on the Ontario Physiotherapy Association website and find at least 40 to 50 job ads. Wow. So if you were the clinician looking, oh, geez, where am I going to go work?
Yeah.
They all look the same.
Right.
So you have to have a better, compelling offer than the next job. And then you're talking about competing with physio to physio clinic, physio to chiro clinic. And then a big one's, what happens if a physician owns a practice? And it's always been, well, that's not the ethical way to do things.
So what's considered, from the point of view of a physiotherapist, what's considered to be the dream position? In other words, you've interacted with so many, and you've counseled so many. What is the perfect makeup? So if you're saying, listen, you want to have and you want to retain great talent, you want to bring in great talent, you have to offer this. And,
right.
and I'm sure, as I know with everything else, money is a part of it, but money rarely is the only thing that keeps you. Money will drive people away, but it won't keep them there either, right? I mean, there's got to be other things. So what are those things that create this ideal environment that we can ultimately, retain great talent?
Yeah, that's great. And we just actually did this. So in the past, I would have said 2 weeks ago, Mo, I would have said it's these 5 things.
Yeah.
But unfortunately, I don't have all the answers.
Yeah.
So what we actually had a conference last week. I pulled up every physio who would consider a job right now, looking for the next move.
Right.
And I said, and I want the younger generation up here because that's obviously who we're attracting at this point in time. Right. I said, what's your top 5? Like, if you were to say that this is the job that I want today, what's the number 1?
Yeah.
So the first one was mentorship. And then from that, though, we built that a little bit further. I said, but what does that mean? No one's giving concrete. I'm like, no, I need to know, what does that mean? So if you can't define mentorship, you can't ask for mentorship.
Yes.
Because I can't put a dollar value on that.
Right.
So then the second piece was culture.
Oh.
Which is interesting, right?
Yeah.
And you and I have had conversations
which goes
in the past.
back to the whole fundamental point. We always think I think you make it about money when there's nothing else there in life, right?
Yep.
But when you have other things that fulfill you, money is usually the last thing on your mind, usually. But keep going. This is great.
Yeah.
Mentorship, culture.
And then from the culture, though, is that a lot of them don't know how do you demonstrate that there's good culture there, right? And one of the key things that I would say that I've seen from individuals who've been very successful of demonstrating their culture have a significant amount of people following them on Instagram.
Really?
Yep. So just just simple little things like movement challenges, or even the stuff that you guys have been working on, right? I'm busy at work, and then I have this fun side to me, which is mountain biking and trail ride. That's how people can start to demonstrate their culture, because it's very hard to put in a job description, right?
It is.
So that was another key piece. The third one, though, was growth opportunity. And oftentimes we have a hard time saying, maybe we'll make you a clinic manager.
Right.
But if you have a small clinic, what are you managing?
But
it's all about taking that young generation and saying, you may not want to be an entrepreneur per se, but entrepreneurship has become a big thing in the physiotherapy industry. I've got an idea, I can make this work,
right?
But I need the infrastructure because I'm a little risk adverse, which is really how I was.
I'll innovate within the structure,
yes,
relative safety of an environment.
That's right.
That like of a business environment, rather than I'll go on my own as an entrepreneur and try to do it
Yeah,
myself.
and maybe in due time they will. But the key thing is that help them champion something,
Yeah.
right? And support them along the way so they can help you and your business impact more patients, right? And then they feel that ability to say, you know what, I just led this,
Yeah.
and I took the reins on this, and look what we did together. And that's a big piece, right? Because their fourth identifier was collaboration. So you can kind of see how those are linked
Yeah,
together.
they're all completely linked.
But it was a little bit hard, right? So I'm poking at these poor individuals in the audience, going, "Well, I didn't sign up for this session to come and talk, but but you're here now. What do you mean by collaboration?"
Yes.
And it's an internal and it's an external component. And internally, they're like, you know what? I just want to be in an environment where I have like-minded people and clinicians and support staff, and we support each other, we talk to each other. But at the same point in time, I want to know though what is the connection within a community, right? So therapists going into private practice, there's a sense that you want to be part of, being in your rural area, or whether you're even in an urban center. What can you do?
Right.
And that's sort of the piece where we always come up with, my background and where I get a lot of questions is, how do you form these relationships with all these physicians, right?
Yeah.
And that was a big collaboration piece that actually takes, when I was recruiting in that world, that's a big driver of an added offer.
So let me ask you this: part of at least when we think about the clinician in orthopedics, muscle, tendon, bone, whatever that is, specifically whatever your vocation in that area is, how does data generally inform some of the things that people do? So, for example, how important in mentorship, in culture, in collaboration is the R word, research involved, and not necessarily that every physiotherapist is wanting to collect data for research, but how important is it for is the use of evidence in the day-to-day lives and practice? And for example, is a quote brand of an evidence-based physiotherapist stronger than the brand of one who wouldn't necessarily brand themselves that way? What is the is there a brand around evidence that is also welcome? I'm assuming the answer is yes, but I don't know the extent to which it permeates. In orthopedics, for example, research and evidence for most academic institutions is it's the highest that you should be aiming for. Many faculty are hired with the prerequisite that they have at least competency in the consumption of evidence-based practice, or in many ways are being hired to do some as part of their practice.
Yeah, no, it's actually a really interesting question, because for us, if you look at what is driven outside of the university, it's about evidence-based practice, and we spend tons of time learning about evidence-based practice, and then bringing that into practice. I think the challenge though, where us as clinicians have struggled for quite some time though, is that there's two concepts, and I don't think they're true by any means, but it's, the research is delayed from clinical practice. So, there's been a change, whether it's a funding change, it's a ministry systemic change already in the industry. And now what the evidence is saying I should do is actually behind, current practice and state. However, there's still a lot of individuals that want to focus on evidence-based practice and looking at, try to take what you guys have built in the evidence-based medicine world and instill into practice and drive those changes. The challenge though for us is that some of our outcome measures are required in a way, right? So I must complete this outcome measure because the funder for patient X requires that.
Right? It's needed.
That's
it happens
right.
a lot in the hospital
That's
system
right.
as well. Right.
And the part though that we're trying to get people to realize though is that evidence-based medicine and practice for us is, there's certainly a clinical component to it, but you also want to be able to figure out how does that drive the patient experience aspect of what we do. Because interestingly for us in private practice is, I'm dealing with a consumer of healthcare. Yeah. So we're really trying to get individuals to realize that what we've done for years in physiotherapy, it's very difficult because it's sort of that art and the science coming together. What I do as a clinician is different than what, the next therapist may do. But as long as we get you better as if you were a patient, Mo, that's a good thing. And then what we want to start to do is get a little bit more thought and energy at the clinical level though. So I'm not going to be a researcher per se, but I want to start to participate in that research. So we start to bring those two worlds closer together and create much more meaningful information, data, and education for patients that's science-based but applicable in real time at a clinic level.
Oh, that's superb. Now, I'm going to flip a little bit to ask about how you manage your day to make all of this happen in your life. So, simple question, what's your morning routine?
Oh, that's a good question. I was going to just start with a very patient wife. But, so morning routine is
What time do you wake up?
5:30.
5:30 a.m.
Yeah.
Okay. What do you do?
So
I mean, aside from the brushing your teeth.
Yeah, no. So it's an
Cold shower,
interesting
hot
point.
shower?
So I've been following, a whole bunch of individuals, habits of, high performing
Yeah.
individuals, right? They say, don't hit snooze.
Yes.
And I was like, okay, I'm going to do that.
Yeah.
New Year's resolution. First day I hit snooze.
Yes.
I'm like, it's just a mindset. So I was like, 6 a.m., get up, go downstairs, and start working. Don't answer emails because I don't have time for emails.
Okay, so you get up 5:30.
Yeah.
You brush all that kind of stuff.
I hit snooze because I had hit snooze.
Okay, you hit snooze.
Hit snooze.
Okay, you get up and then you shower, or do you just go right?
No, right. I got to do some work downstairs.
Okay, so you go downstairs. What work do you do?
So that's sort of where my mind's the freshest in the morning.
Yep.
So I've got a day where, and what I usually spend time on is what do I need to do that day. So I make sure that I block and batch my schedule.
So scheduler, planner. Are you on your iPhone or are you on a computer or are you just?
No, I'm on my laptop.
Laptop. Okay, so you open your laptop. How long are you on that for? I know. I'm giving you.
No. About 30 minutes to 45, depending on what I have to do.
No emails at that point, or just actually you're planning your day. Okay.
Yeah.
Laptop closed. What do you do?
Then I'll go up and just wake the kids up.
Yeah.
I actually have to phone my wife though because she needs to get ready for work first.
That's awesome.
And she'll sleep through, so I have to call the house, and she gets up because I'm downstairs in my office.
Yeah.
Yep. And then it's kids to school, and then it's the office.
Okay, and then at some point you're showering and getting ready.
Oh yeah.
Okay,
In there.
So that's happening. Okay, so I was just in Helsinki, and they are big proponents of the cold, and sort of the hot and cold cycling. Do you have any sort of routine around hot or cold?
No, it's always hot.
That's always hot. Okay.
Yeah.
Try cold. 30 seconds. I've been told. Right. There's interesting stuff. I've been trying for 30 days to go with the cold blast in the morning.
Mm-hmm.
Apparently has all kinds of benefits. Fewer sick days apparently. So
really?
I'm going to test it. Yeah. I'll send you the paper for that. It's actually pretty
that's
interesting.
good to know.
Okay. So you get up, you do that, and then so what time are you usually out of the house and into your quote day, or are you working from home a lot? I guess.
No, with me being at the hospital still right now too.
Right.
I'm in the office most days, so I'm out of the house by about 7:45.
7:45. Okay.
Yeah.
And your typical work week hours?
Yeah, I would say the hospital wise, it's around 40, 44,
Yeah.
and then
All
looking
the
after
other
the
things
clinics and
are-
the boot camp and the coaching and stuff. So I'm probably around 60 to 70 hours.
Yeah,
a
so that's a
week.
lot. And then final thing is, what do you do outside of your work? And I have this real belief, and we'll probably spend more time on another time, that the things you do outside of work actually make you better at your work. So what are kind of the things you like to do outside of your core business?
Yeah, no, it's a great question, and you and I've had these conversations for quite some time about
Right.
that. So so it's still that piece where there's dedicated family time. So it's in that schedule that Fridays or it's family time. It's movie day,
Awesome.
right? So it's just keeping you grounded that way for myself. But then there's always that piece where every week there's a night out with it's hockey and it's we're clearly a little bit more on the hack side of things now, right? But it's still fun, and it's a matter of chatting with your friends. But it's nice because it's different than just going out and in the past where you just had these these boy weekends, right?
Yeah.
But now it's about it's taught about work. How's it going? What's going on at your office, and what are you struggling with?
Perspective,
Yeah. And at the
On
same
top of
point in
getting
time
some-
is
get the
having fun, a
adrenaline.
little bit of activity, but it's trying to where I need to get to a little bit better now though is more in a routine though, or get my physical activity back up. And as a physiotherapist, I should know this better.
Right.
But getting back into some of those routines,
Yeah.
because at a point though is we've talked about it before, is how much more hours in a day can I do that are going to make me better at what I do, as opposed to keeping me healthy and keep my mind in a better state, and then your productivity actually becomes better that way.
Wise words. And on that note, Darryl,
Hey,
wonderful to have you. Thank you so much.
Awesome. Thanks for having me. It was great.
Thanks for watching OrthoPod. Stay tuned for more episodes.